NMC Medical Center.
Sometimes when you're down, all you need is a caring human touch to make things better. The human touch that can set things right with a smile. So you can get back on your feet. To celebrate the little miracles in your life. And see the world again with all its possibilities. At NMC, you have every reason to smile. NMC Medical Center.
Doctors In, presented by NMC Medical Center.
Good afternoon and welcome to NMC Medical Center, Doctors In. So today I have with me Dr. Radhika Keval-Ramani from NMC Al Shaba, Sharjah. She is the endodontist there. She's practicing in the Sharjah Al Shaba branch. So today, ഇന്ന് ഡോക്ടർ മലയാളി അല്ല, അതുകൊണ്ടാണ് ഞാൻ എൻ്റെ ഇൻട്രൊഡക്ഷൻ ഇംഗ്ലീഷിലാക്കിയത്. അപ്പം ഇന്ന് ഡോക്ടർ നമ്മളോട് റൂട്ട് കനാലിനെ കുറിച്ചും അതിൻ്റെ സംബന്ധിച്ചുള്ള കാര്യങ്ങളായിട്ടായിരിക്കും ഡിസ്കസ് ചെയ്യുന്നത്. സോ ഷീ സ്പെഷ്യലൈസ്ഡ് ഇൻ റൂട്ട് കനാൽ ആൻഡ് ഷീസ് ഡൺ ഓവർ 6,000+ റൂട്ട് കനാൽ ട്രീറ്റ്മെൻറ്റ്സ് ഡോക്ടർ ചെയ്തിട്ടുണ്ട്. പുള്ളിക്കാരത്തി ഒരു ബുക്കും എഴുതിയിട്ടുണ്ട്. അപ്പം ഡോക്ടർ, വെൽക്കം ടു ദി ഷോ.
Thank you, Atira, for calling me.
You're welcome. So I was just introducing you to our viewers. So I was telling them that you have written a book which is internationally published.
Yes.
So let's start with that. What is that book all about?
It is called Cone Beam Computer Tomography, a practical guide. It is basically, there is this lot of advancements that are happening in dentistry and especially in endodontics right now.
Okay.
So we have this a miniature form of a CT which helps us to scan the tooth in a 3 dimensions, and it helps us to understand the tooth way better before we go inside and do root canal treatment.
Great.
So
Okay.
it is all about that, and for the dentists who read about it, they will get to know how to use this modern technology and use it in their daily practice. It is available in UAE very widely. So when you have the best technology, we should use it.
Correct,
We
yeah.
should imbibe it so that we can give the best treatment for our patients.
Okay, great. So in the you will be talking about that more about what this technology and how we can use, how the
Yes.
people can understand about
Yes.
it. But doctor, ഇന്ന് നമ്മുടെ ഈ പുതിയ ടെക്നോളജിയെ കുറിച്ചും അത് എങ്ങനെ നമുക്ക് നമ്മുടെ ചികിത്സയ്ക്ക് വേണ്ടി ഉപയോഗിക്കാം എന്നതിനെ കുറിച്ചൊക്കെ പറയാൻ പോകുന്നത്. ഫസ്റ്റ് നമുക്ക് ഡോക്ടറിനോട് ചോദിക്കാം, എന്താണ് ഈ എൻഡോഡോണ്ടിസ്റ്റ് എന്നുള്ളത്? So what is endodontist, doctor? What exactly
So
it is?
in a layman's term, I would say we are root canal specialists.
Root canal specialist. Okay.
Yeah. So first we undergo 5 years of training in dentistry to get a basic degree.
Okay.
And then as endodontists, we undergo a 3-year of specialized training.
Okay, just
where
for root
we are,
canal.
Yes.
Okay.
Root canals, and there are certain related procedures to that. So endo means inside. So we basically study what's inside the tooth.
Okay.
So we are the dentists whom the patients come for when they have toothache or a swelling.
Okay.
Thing. So we
The gum
take care.
swelling and all that.
Yes, sometimes root canal, the teeth that require root canal can manifest gum swelling or even a facial swelling. But more commonly, I would say it is pain and sensitivity, too much sensitivity. They cannot eat anything cold or hot.
Okay.
Yeah, yeah.
സോ നിങ്ങൾക്ക് ഇത് സംബന്ധിച്ചുള്ള സംശയങ്ങൾ ചോദിച്ചറിയാം, ഡോക്ടറിനോട് നേരിട്ട് ചോദിച്ചറിയാനായിട്ട് വിളിച്ചാൽ ഡോക്ടറിനോട് സംസാരിക്കാൻ സാധിക്കും. സോ വി ആർ എക്സ്പെക്ടിങ് കോളേഴ്സ്.
Yeah,
So till
that's
then,
great.
So I would also like to know what exactly this root canal is.
Okay, so before I can talk about root canal, I will just explain a little bit about what is a tooth. So what you see in your mouth, the whites, they are called the enamel. Below that is a dentine, and below that there is the heart of the tooth. It's called the pulp.
Okay.
So it contains nerves.
When you say below, it is like inside where we cannot see.
Yes,
Yeah,
you cannot
okay.
see it.
Okay.
And it's not just what you see. Your tooth has another portion that goes and
Correct.
engages
We see that in
itself.
X-rays, which is the
Yes,
extended
yes,
part.
those are the roots.
Yeah.
So that is basically the heart of the tooth. Okay, so every time you have an ice cream, you feel that sensitivity, right?
Correct,
You can
yeah.
make that out, right? That is because there are nerves inside your tooth, which is the pulp.
Okay.
So sometimes what happens if there is a decay? So the decay starts from the enamel, what you see, and then it keeps going deeper and deeper, and then it touches the nerves.
Okay.
And when that happens, it's a painful experience. So what we do is we remove all this decay. Decay is basically, what is it? It's bacteria, right? So we want to take that bacteria out from the tooth. We want to clean that decay up, and we want to remove those infected nerves from inside. And we want to make a sterile environment inside the tooth and then seal the tooth. So this is like the last attempt to save the tooth. If it is ignored at this stage, and if a root canal is not performed, then the only next stage is to get the tooth removed. So we also like to call ourselves the saviors of teeth. Okay, so because we get the patients out of pain, and we make sure that the tooth stays in their oral cavity just as God has made it for the rest of their lives.
Okay, so when should somebody take attention to these kind of, because normally when we have cavities, if we don't have a pain, or if it is not very sensitive when we do something, we don't pay attention to it. We do the normal brushing, and then, maybe flossing, and then that's it, and then we don't take much care of it. So when should somebody take care of it or come to you for further treatment?
Yeah, it's actually such an irony, right? Because we take care of our hair, we take care of our skin. I think teeth deserve the same kind of respect. So I would say that prevention is better than the treatment. So I would recommend everybody start basic things at home, brush twice daily, that's very important, and visit your dentist at least once in 6 months. Because what happens is, if the cavity, it is very, 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 very small, we can take care of it immediately without needing a root canal. But when you have symptoms such as sensitivity, so you say you're eating an ice cream and you feel that sensitivity, sometimes it may be normal, sometimes it may not be normal. It may not be normal when you're eating an ice cream and you jump out of pain and you're like, oh God, I cannot eat this ice cream anymore. That's when it could be an indication for a root canal treatment. Another thing is pain. So just you're sitting, just enjoying your life, and then suddenly the pain comes out of nowhere and it's quite severe and you have to take painkillers. That's when is another indication when a root canal treatment would be needed. Or there could be a swelling that can come. So I would always say that visit your dentist before it's too late.
Yes, visit your dentist before it's too late, and once in 6 months, it is necessary that you go and see your dentist. Because നമുക്ക് ബാക്കിയുള്ള എല്ലാ കാര്യങ്ങളും നോക്കുന്നത് പോലെയും പല്ലും is very important. അത് നമ്മൾ timely കെയർ എടുത്ത് timely ഡോക്ടേഴ്സിനെയൊക്കെ കണ്ട് timely ട്രീറ്റ്മെൻറ്റ്സ് എടുക്കുകയാണെങ്കിൽ നമുക്കിപ്പോൾ ഉള്ള നല്ല പല്ലുകൾ നമുക്ക് വയസ്സാവുന്നത് വരെ അങ്ങനെ തന്നെ നിൽക്കും. So yeah, and for the root canal patients or people who have problems with their root canal, is pain compulsory? Okay, I'll continue this question because we have a caller. So let's see what the caller needs. Hello?
Hi, this is Suraj here calling from Sharjah.
Hi, good afternoon, Suraj. Welcome to Doctors In.
Thank you. I have a question. I just want to know what are the things that we can do to take care of our gums.
Gums, okay. Do you have any particular gum issues?
Yes, so my gums had become reddish and there was pain earlier. So just wanted to know what could be done.
Sure, doctor.
Okay, so gum diseases are really common. So what can be done is, apart from what you have been doing all this while, that is brush twice daily, you have to floss regularly. But now that you are having red gums means that there is a gum infection that has set in already. So now what you would need is an evaluation and a cleaning procedure. It's called scaling in dentistry. So we want to get those deposits on the teeth out, because those are acting as irritants for the gums. And depending on the severity of the gum, there may be or may not be additional procedures that may be required for you, that we have to check, and then we can tell you more about it. Also, you will have to use certain gingival gels, gum gels, or mouth rinses as well. And once this problem of yours, that is gum problem, say you have done a cleaning and that's resolved, don't take it lightly, because this can recur. So you have to make sure that this gum disease does not increase, and regularly go for cleaning procedures. Also, I would also like to say this, that I don't know how many people know this, but if a person is diabetic, if you are diabetic, the gum problems are even more. So make sure that your overall health is also good. So make sure that you are free of any diabetic problem as well.
Okay.
So Suraj, are you clear with your doubts? ഇനി എന്തെങ്കിലും ഉണ്ടോ ചോദിക്കാൻ?
Yes, I am. Thank you so much.
Thank you, Suraj. Thank you so much for calling.
Okay. Bye-bye.
Okay, so you just mentioned people who are diabetic. So people who are diabetic, how should they take care of?
So, see, if it is a person who has diabetes which is controlled, then usually the gum problems are not that severe.
Okay.
But in patients who do not know they have diabetes, or their diabetes is not under control, what happens is that the gum, it starts showing in the gum. So they will have problems like they will more frequently have bleeding gums. They'll more frequently have swelling in their gums. They may have gum pain as well. And there is this research, and it's quite extensively published, which says that if you are a diabetic, your gum disease worsens. And if your gum disease worsens, your diabetes worsens. So they are related to one another. Yeah. So just taking care of the gums is not enough. You also have to get the diabetes under control. Both are linked to each other.
Okay, that's quite a news actually.
Yeah.
I don't think many people know about that diabetes has a correlation with your gum issues.
Yes. It also has a correlation with preterm labor. I don't know how many people know.
Yes, that I've heard because during our pregnancy they test for, they kind of test whether you have a diabetic or not. Or people tend to have diabetic during that period.
Yes, gestational diabetes. Yes, you're very right.
All right. So, is all root canals treatment very painful? Is it?
That was back in the 19th century probably because it's usually shown in movies, right? That root canals are so painful.
And we kind of be dreadful to go to the dentist, for a root canal. Oh my God, that's going to be.
No, it's not like that because right now we have very good anesthetic techniques.
Okay.
So, when I do root canals on my patients, we make sure that the patient is completely numb before we start. Actually, quite the quantity.
Is it for a very severe one or for even a normal small root canal you do the
Yes, we do it for all the procedures. As unless the tooth is completely dead and the tooth is completely asymptomatic, then very, very few cases we will not numb it if it is not required. But most of the cases we numb it. And what happens is that when patients come to me, they are in a lot of pain. They've not
already
slept.
in pain, yeah.
So they come on the dental chair, we give them an anesthesia and the pain suddenly goes away because the anesthesia starts to work.
Okay.
And they find the dental chair so comfortable that sometimes I have problem to keep them awake. Then they will close their mouth.
I know.
We want to make sure they open their mouth. So it is very comfortable, don't worry. Probably you will feel that little pinch
of the anesthesia.
But now we have a lot of things that we do to even, keep that to a minimum.
Great. So we have another caller here. Hello? 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 ആ ടിവിയുടെ സൗണ്ട് ഒന്ന് കുറച്ചാൽ നമുക്ക് നേരെ കേൾക്കാമായിരുന്നു. ഹലോ?
ഹലോ.
ഗുഡ് ആഫ്റ്റർനൂൺ.
ഗുഡ് ആഫ്റ്റർനൂൺ.
ആ ടിവിയുടെ വോളിയം ഒന്ന് കുറയ്ക്കാമോ? കാരണം നമുക്ക് ടിവിയുടെ ശബ്ദമാണ് ഇവിടെ കേൾക്കണേ.
ഹലോ.
ടിവി വോളിയം ഒന്ന് കുറയ്ക്കാമോ?
ഹലോ.
ഹലോ.
ഗുഡ് ആഫ്റ്റർനൂൺ.
വെരി ഗുഡ് ആഫ്റ്റർനൂൺ. അവിടുത്തെ ടിവി വോളിയം ഒന്ന് കുറയ്ക്കാമോ?
Okay, I want to ask the question from Dr. Radhika.
Sure, definitely. May I know who's this?
This is Kiran here.
Kiranya.
Yeah.
Kiranya.
See, my front tooth has become like a yellowish sort. I don't know why it is like this.
Okay. So is it only like one tooth which has changed its color? It's like all the teeth?
No, it's only one tooth that has changed the color.
Okay. And it's from how many years that?
It's from around 2 years.
From 2 years. And it has started to become worse?
No, not at all. It's same.
Okay. Did you have any hit or fall on that tooth?
No, nothing.
Is it painful?
No, not at all.
Okay. See, since it's only one tooth that is discolored, means there is something going on in that one tooth because remaining teeth are not discolored. There is a chance that you may have had some kind of trauma on that tooth. It could be from eating something hard or opening something using your teeth. We cannot really know what caused it. But it seems to be a case where the tooth is discolored probably because of trauma. So we will have to take an X-ray to make sure we understand what we are dealing with, if there is an infection that is there inside the tooth or not. If there is an infection, maybe you will need a root canal treatment. But good news is, in your case, you don't have pain, so it will be a very straightforward procedure to do. And after that, if there is no infection, then we will have to treat the tooth by doing bleaching, or it is a tooth whitening procedure in layman's term. So we'll put some bleach onto the tooth, either externally, like from the outside, or depending on your case, from the within, and then that bleaching agent will work, and hopefully it will it will work out, and it will make it of the same color. If that does not work out, then there are more higher options that are there. There is Hollywood Smile or veneer. Then there is option of putting a cap on that tooth and changing its color. So really, first we need to know the cause. Once we know the cause, we know what the treatment is.
Okay, fine.
But
That's
get in
good.
touch with your dentist.
Sure.
Yeah, you
Thank
can
you so
meet
much.
Dr. Radhika at the NMC branch, which is in Al Shaba in Sharjah.
Sure.
Yeah.
Thank you so much.
All right.
Thanks.
Thank you so much.
Thank you. Bye.
Thanks.
Okay.
So coming back to the root canal.
Yeah.
So how many times, if somebody with a normal root canal issue, when they come for a consultation, how many times or how many sittings would they need to complete the entire
That's a very
procedure?
good question.
Okay.
So usually 1 to 2.
1 to 2.
Yes, sometimes it may require more, but most of them we complete within 1 to 2 sessions. So if it totally depends on how much infection is there in the tooth. So if it is a patient who has come with pain and just has severe sensitivity to hot or cold, usually those kind of teeth are not very infected. They are just at the beginning stage. Those kind of cases we do it in one sitting also. But if there is a tooth that has a lot of infection, there is a swelling or there is an abscess formation, those kind of teeth, we want to place the medicine inside the tooth because we want to kill that bacteria inside. That is our goal, to get rid of those bacteria. And when there is a swelling and all, there are millions of bacteria that are there. So it takes time.
Okay.
So in those kind of patients, we'll place the medication and probably recall them after 1 to 2 weeks and then complete our root canal treatment. So we really like to listen to what the tooth is trying to tell us, get an idea of how much infection has set in, and then according to that, we decide. Usually 1 to 2 though.
1 to 2. And then is there any follow-ups required, like after a certain period, like in 6 months, 3 months?
Yes. So after your root canal is completed, it takes care of your symptoms, it takes care of your pain. But after the root canal, you will also need a crown procedure.
Okay.
Which means like a cover on the tooth. Most of the teeth, not all of the teeth require it.
Okay.
So that is, when we do root canal, we get rid of the infection. But if you want to use the tooth for biting something hard, you will have to make it stronger by placing a crown on it.
Okay. Crown is like a cap?
Yes,
Okay.
it's like a cap. It surrounds the tooth completely, and it prevents the tooth from cracking down under eating pressure.
Okay.
Sometimes we don't do it. Like in a front tooth, if it's an intact tooth, just the patient had trauma because of that, like we had in the previous caller, right?
Yeah,
So those kind of cases, maybe we will not go ahead and do a crown. And sometimes root canal, after the root canal treatment, patients just leave it. It's not supposed to be that way. You have to follow up. So the first follow-up that I do is after 7 days. So if I've completed my root canal, I call the patient after 7 days, make sure that they are off the pain, there are no symptoms, I hear what they have to say. If everything is good, we move on to the next stage of capping, and then they have to come every 3 months and 6 months for regular follow-up. Also very important is you have to maintain that area. So you need to floss that area because you have to understand that we have put a crown which though it replicates the natural tooth, it's still something foreign.
Yeah.
So you have to maintain that so that no other additional gum problems or decays develop on that tooth later.
All right, we have another caller. Hello, good afternoon.
Hello.
Good afternoon. Welcome
Good
to
afternoon.
Dr. Zen.
Is the doctor there?
Yes.
Yeah, the doctor is here, very much here. Who is
Alright.
this?
Hi, my name is Fadwa.
Fadwa.
Yeah.
Welcome, Fadwa. We have Dr. Radhika here.
All right. Actually, I have a doubt, doctor. Can you clear
Yes,
it?
yeah. Hi Fadwa, how are you?
Yeah, I'm good.
Great.
Okay, so my dad is having an issue with his tooth.
Okay.
I guess it is his premolars.
Okay.
So he's having a sudden pain, like you have said previously.
Yes.
He got pain all of a sudden, and then he took a medicine called ibuprofen.
Ibuprofen, yes.
Yeah, and he has swelling there since today morning.
So
And-
swelling on the face or just internally?
No, internally on
Okay.
the enamel, I would say.
Okay, fine.
Yeah, so and he has a swelling, and
From outside when we check, there is no, cavity. I guess like a stain, a black stain is there.
Okay.
And do you think we would need a root canal, or like what would be?
Yeah. So that's I'm very sorry that your dad is going through this pain. I can totally understand it. See, you see a black stain, but there are certain areas of the tooth that are not visible directly by the naked eye. So there could be a decay between the teeth, which is not visible from the outside.
Yeah.
Or there could be a crack in the tooth, which can cause this kind of symptoms. But the kind of symptoms that you are saying, swelling, pain, and you say it's a premolar tooth, these things are pointing towards needing a root canal treatment. Although sometimes gum diseases also can cause pain and swelling, so we need to rule out if there is a decay that has gone into the nerves, then he needs a root canal. If the swelling is secondary to some gum disease, then he will require the gum treatment. If there is a crack, then we will do the treatment accordingly, but points towards either a gum disease or a root canal. Does he have pain at night as well while sleeping?
Yeah, like as now he is positive of coronavirus and he can't go to a doctor. So he consulted him on, like he called him and then he said to have ibuprofen. So he's having it. While he's having it for like some hours, it's okay. And then again it starts.
Okay, I would give you one tip here. Firstly, don't take painkillers as and when you have pain. Take it round the clock. Stay ahead of pain because this is a root canal pain. If the swelling increases, you may have to add an antibiotic because we are not going in and starting the treatment. So we don't want that swelling to go out of hand. So you may need to add an antibiotic also, a simple one like Augmentin. You can just add that as well, and but the moment he turns negative, you can go to the hospital and get the emergency treatment, and at any time the emergency departments are open and we can deal with the swellings and all, even while he is positive.
Okay. All right.
Okay.
Thank you.
Take care.
Thank you.
Bye.
Thank
Bye.
you.
Thank you.
So earlier we had this caller who said that this decoloration has come.
Yeah.
So what are the other reasons? She said, I mean, she doesn't know the reason why the decoloration can you explain more on why people get this decoloration?
So discolorations happen for a lot of reasons. There are two types, external and internal. So what this patient whom we spoke to, Kiranya, what she had was an internal discoloration because it's a single tooth that is involved. With external means you have a lot of tea, coffee, or there's a history of smoking or pan. So these causes external stains. So the stains get stuck onto the tooth. They are easy to treat. You just have to need a round of cleaning. Then there are internal stains. Internal stains, usually it will be affecting one or a group of teeth, not all the teeth, most of the time. And even if a tooth has undergone trauma, so suppose a child fell down unfortunately, the tooth can turn pink and later it can turn black, which means that the nerve is dying state. So that is another reason why the tooth discolors from within, because the nerves are within the tooth. And there are certain, during pregnancy, if there are certain drugs, if that is given to the pregnant mother, or even in the first 4-5 years of life, if the child is given certain drugs, it can actually cause discoloration of teeth from within. That's another reason why the discoloration happens. But most of the time, what I see in my practice is external discolorations or discolorations due to trauma to the teeth or because of a decay on the tooth.
Just coming back to when pregnant mothers have medicines and the child have the effect on the teeth. I've seen a lot of kids nowadays, I don't know, from my experience or where I see kids, a lot of kids have this decay as they grow up in their milk tooth itself.
Correct.
So what could be the reason? Because they might be drinking only very small age, as in when they will be only feeding on their mother's milk. At that point itself, they start decaying, teeth decaying as a new milk teeth.
Okay, there are various reasons why that happens. One of the reasons that is called nursing bottle caries. What happens is sometimes when a child cries, the mother, we can place the nursing bottle in the child's mouth and keep it for a long hours, or we can give those pacifiers, to them, which are actually sometimes sugar coated. So you see, the the duration for which the tooth gets in contact with sweets or with milk is longer. So in that cases, what happens is that there is a decay that can start onto the tooth. Also, I would like to say, no matter the moment the first tooth comes in the mouth, as mothers, we have to make sure that we clean that, taking a gauze or a cotton, and we just wipe that tooth and keep it clean, because any kind of food, milk, if it's there on the tooth for a very long time, can cause a decay. And like you said, milk teeth, we would like to go in, when they're as young as 1 year and 1 year old, and we would like to place like a gel which is called fluoride to make sure that the tooth become more resistant to decay. Some of the times, genetically, the resistance to decay is lesser for some people. So that fluoride, the resistance to the decay increases. So we would want to give fluoride gels to these particular children, or put some pit and fissure sealants, to make sure that the food does not get lost.
That's again a treatment. That's not like something we can buy over the pharmacy or put it on us.
That is done as regularly. Yes, our toothpaste have fluorides. But not in a quantity which can show effect immediately. When it is done at a dentist's office, the effects are usually more fast because the concentration is slightly higher of fluoride. So that is the reason cavities unfortunately happen in children as young as 1 year or 2 years, and affecting a lot of teeth.
teeth decays.
But it is preventable.
It's preventable. And when children, when they come up with this root canal issues or decaying issues, do you do root canal treatments for children who have this milk teeth?
Yes, yes, we do, but we don't call them root canal, we call them pulpectomies and pulpotomies.
Okay, doctor, sorry, I'll cut you now, and we'll continue this after this call.
Okay, sure.
Hello.
Hello.
Good afternoon. Welcome to Doctor's In.
Yeah, good afternoon. I wanted to ask a question with Dr. Radhika.
Sure, you can. May I know who is this?
This is Archana.
Archana. Welcome,
Hi, Archana. How are you?
Yeah, good. Thank you for asking.
Please go ahead.
Actually, I wanted to ask the upper jaw, the front two teeth, I don't know, they are called incisors or
incisors,
what.
Yes.
There is a gap which has been developed now of late, maybe last 6 months.
Okay.
There is a gap which is built up between the two teeth. So I wanted to know that why does it happen, and is it going to increase with time?
Okay.
So what should I do about it?
Do you see any decay on those teeth?
No.
No, but the teeth are drifting apart.
Little, yeah. Little, like you can see a line, that they are drifting little bit apart.
Okay. So this can be because of gum disease. Okay. So what happens is the tooth, they are firmly anchored inside the bone. Now when the bone becomes slightly weak, then these teeth cannot be held by the bone that firmly. So what happens, the teeth start to drift away slightly.
Okay.
But there are other reasons also, like some people have a larger tongue, so they tend to protrude their tongue, like put their tongue and push it out.
Yeah.
That could be one of the reasons why the teeth can be drifting apart. If you are very, very young, then as a growing age, it can drift apart. So, but most of the times, it is either something called tongue thrusting habit, or it's a gum disease, which you call it periodontitis, because now the teeth are drifting apart. So it's an advanced stage of gum disease. Yes, if not taken care of, and it is a problem of gum disease, then yes, it may worsen with time, and you don't want to do that, because bone is not like root canals. You do the root canal, you can save the tooth. Once you've lost the bone, it's very, very difficult to get that bone back. So really, the essence of your case is time. So get it treated as soon as possible, and you would actually need someone known as a periodontist once you have the gum disease diagnosed. If there is any other cause of it, like a tongue habit, or your teeth are not biting in a proper way, so the lower teeth are actually pushing the upper teeth outward, then you may need braces treatment. Those are the other additional reasons why the teeth drift apart.
Okay. Now my age is, I'm 45 plus. So And there is no other reason, like I don't have a habit of,
Thrusting.
like tongue, pushing the teeth with the tongue. So I also noticed just, I think 3 months back that suddenly I see a small gap, So I was just scared that maybe it will keep increasing with time. So then should I,
Yeah,
need
you will
to
have
address
to,
it.
yes. Do you have any other, if you don't mind me asking, any other medical conditions?
Mm, like blood pressure, diabetes and all?
Yeah.
No.
No? Okay. But still, just get your blood sugar levels checked. Sometimes it can, some people don't know and they are at a borderline stage of diabetes. That could be one of the reasons. Most of the time it is deposits on the teeth. So you want to get those deposits on the teeth out so that there is no irritation to the gum, and how much ever your teeth have drifted apart, it can hold there. If you want cosmetically to close this gap, there are a lot of options that you can do. So there are a lot of options, like there are crowns, then there is orthodontic treatment that we can use to bring those two teeth together. Or we can just do a filling and cover that gap up. But first, if we don't treat the cause, then we do not, then whatever treatment is done is not
So I should
correct.
go and check and I consult a periodic.
Yeah, you can consult a dentist, any of us.
They will root it.
Yes, and then first we will find out what is the cause. But if it is a gum cause, then yes, you will be referred to another doctor who is a specialist in gums called periodontist. Yes, because we want to get that bone and that gum to its correct health. And then once your bone and your gum is in the correct health, then we cosmetically go about treating that gap that you have developed cosmetically.
Okay. Got it.
Okay.
Yeah. Thank you so much.
Take care.
Thank you, Archana.
Thank you. Bye-bye.
Thank you. So yes, doctor, coming back to what we were discussing about
for children.
Yeah.
Yes. So it's called by a different name. The procedure is more or less similar, but when we do a root canal, we place something more permanent inside the tooth. Because when we are doing the milk tooth root canal, we don't want to place something permanent inside.
But for the milk, for milk tooths, do they have roots or root
Yes.
They have.
They have roots. But what happens is that, so the milk tooth is there and the permanent tooth is somewhere below it.
Yeah.
So how does a permanent tooth come out? What does it do? It starts eating away the roots of the milk tooth, and then it comes step by step outside.
Okay.
Yeah. So those roots are very much there, but we don't fill it with something permanent. We fill it with something more temporary, like a zinc oxide eugenol or some medication paste, so that the body is able to remove those roots and that material that we have filled in, so that the natural tooth comes out. Yeah. That is the way.
So is that painful for kids to do?
No, not at all.
Not at all.
Not at all.
Okay.
It's a simple procedure, relatively simple procedure. Once we numb, they are all good.
They are all good. Okay.
Yeah.
And how about pregnant women? If they are pregnant, can they undergo this root canal treatment?
Yes. Now we have very good technology where we don't fully rely on X-rays, because X-rays is a concern.
Correct.
And although it is safe, when we make the pregnant patients wear lead aprons, sometimes we make them wear 2 lead aprons as well. Well, it is completely safe, and this is told by American Association of Endodontics, and it has been confirmed by American Association of Gynecology as well.
Okay.
So now it is safe to take X-rays, but we try to keep it to a minimum or just avoid it in totality. And second trimester is what is usually considered the safest time, but with root canal, it's pain, right? Like we cannot say the pain will come only in second trimester. Correct. So yes, in whichever trimester it is, we can go ahead and get the patient out of pain by initiating a root canal or even completing a root canal by using technology that does not make us rely on X-rays a lot.
Okay.
Yeah. But for pregnant patients, I always tell, like, the hormones are completely out of control. They are all over the place. So the gum diseases, the decays, they all tend to become even worse during pregnancy. So before pregnancy, if you're planning for a pregnancy, make sure you visit your dentist, because you want your pregnancy time to be, you have a lot of other things to think about, and you don't want to go through a dental pain during that time. So as much as possible, just have dental cleaning done, a decay filled, so that nothing exacerbates
I
during.
think these are things which normally we neglect.
Yes.
And even it's pregnancy or even in a normal case, we neglect these kind of periodic checkups and cleaning and procedures and everything.
And we save a lot of money.
Correct.
Because actually root canals, then crowns, or worst cases extractions and implants, at the end of the day prevention is better than cure. So you invest slight money into your health of your teeth, you get your natural teeth and you can keep it for lifetime.
Correct.
So old people losing teeth is a myth, it's no longer true. Yeah.
Okay. Okay, so let's take a small break. We've been talking for so long.
Yeah.
I think we need a small break. We'll come back soon after the break.
Doctors In, presented by NMC Medical Center.
Sometimes when you're down, all you need is a caring human touch to make things better. The human touch that can set things right with a smile. So you can get back on your feet. To celebrate the little miracles in your life. And see the world again with all its possibilities. At NMC, you have every reason to smile. NMC Medical Center.
ഓർമ്മകളുടെ ചിരിയും സന്തോഷവും നിറഞ്ഞ ഈ ഒത്തുചേരലിൽ കണ്ണുകൾ പ്രിയപ്പെട്ടതെന്തോ തിരയുകയായിരുന്നു. ആ ഒരു പുഞ്ചിരി കൊണ്ട് ഇതൊരു മറക്കാൻ പറ്റാത്ത സായാഹ്നമാകും. ഞാനെന്നും ഓർക്കും നിൻ സ്നേഹാർദ്ര ബന്ധം. ഓർമ്മകളുടെ ആ ചെറിയ നിമിഷം എനിക്ക് ഓർമ്മയുണ്ട്, പക്ഷെ നീ മറന്നുപോയി. കുളിരോർമ്മയുണ്ടെന്നുള്ളെല്ലാ നിമിഷങ്ങൾ വരവായി. ബാല്യത്തിൽ നീയേകിയ കരുതലിലോർമ്മയ്ക്കായി. നീ സ്കൂൾ വിട്ടുപോയി, എനിക്ക് താങ്ക് യു പറയാൻ പോലും പറ്റിയില്ല. നിനക്കായി മാത്രം സഖി സ്നേഹോ. ഇതൊരു പാട് മനോഹരമല്ലേ? പക്ഷെ നമ്മുടെ സൗഹൃദത്തിനപ്പുറം ഒന്നുമില്ല. ജോയ് ആലുക്കാസ്, ബന്ധങ്ങൾക്ക് അമൂല്യ വില കൽപ്പിക്കുന്നവർക്കായി. ജോയ് ആലുക്കാസ്, വേൾഡ്സ് ഫേവറേറ്റ് ജൂവലർ.
ഓക്കെ, അപ്പൊ ലിസ്റ്റ് റെഡി. നമ്മുടെ അടുത്ത മാസത്തെ സാലറി വന്നിട്ട് നമുക്കൊരു കിഡിലും ഷോപ്പിംഗിന് പോവാം.
എന്തിനാ അടുത്ത മാസം വരെ വെയിറ്റ് ചെയ്യുന്നേ? ഇതിപ്പോ തന്നെ നമുക്ക് avarshopee.com വാങ്ങാതെ. ഷോപ്പ് നൗ പേ ലേറ്റർ ഓപ്ഷൻ ഉണ്ടല്ലോ. വളരെ ചെറിയ ഡൗൺ പേയ്മെന്റ് ചെയ്ത് ഡെബിറ്റ് കാർഡ് വഴി നമുക്ക് ഷോപ്പ് ചെയ്യാം. ഇനി നമ്മളുടെ ആഗ്രഹങ്ങളെല്ലാം ഉടനെ വീടുകളിലെത്തും. കാരണം avarshopee.com ഷോപ്പ് നൗ പേ ലേറ്റർ ഓപ്ഷൻ അത്രയ്ക്ക് അടിപൊളിയാണ്.
ഷോപ്പ് നൗ പേ ലേറ്റർ ഫ്രം avarshopee.com.
A promise backed with years of experience. A promise of secured and safe goods transportation. A promise from trusted brand among the movers. Fly Express Cargo and Courier. The promise of delivery on time.
Doctors In, presented by NMC Medical Center.
Welcome back. So, welcome back, Doctor.
Hi.
So, is there any way that we can prevent this root canal treatment?
Yes. That's a very good question and a very important question as well. So, for children, begin as soon as possible. If you want to prevent decays in your child, start from the first time the tooth comes into the cavity. It's a milk tooth, but start using a gauze, clean that tooth up.
Yeah, that's very important. I think people do neglect that very much.
Yeah. And once the child is like 3 years or lesser than 3 years, you can use a toothbrush, and you can use, if you're using an adult toothpaste, just use like a very small, like a grain of rice.
Grain of rice
for less than 3 years. And then you can brush. You have to supervise their brushing till 7 years of age, and make sure that you visit your dentist during this time, so that at the office we can do procedures such as fluoride treatment and pit and fissure sealants, because that will strengthen the tooth and prevent it from catching a decay up to 60%.
Sorry, this fluoride treatment can be done for a normal child, as in who doesn't have any decay, or?
No decay.
No decay.
We do
It's like
fluoride
prevention.
treatment. Yes,
Yeah,
it's a complete prevention. It's a very simple procedure. We take the fluoride gel, we apply on the teeth, we wait for some time, and the patient can go. That's all. It's a 1 minute procedure.
So that's a preventive treatment.
Yes.
Kind of.
Yes. For adults, what you can do is is start taking 5 minutes extra from your life every day. Brush twice daily. That is very important. See some YouTube videos. There are so many videos on how to floss.
Floss. Yeah, that was one question I wanted to ask. How to floss.
For those people who find it difficult to use a regular floss or learn the technique, they can use a water flosser. It's easily available.
Is it water flosser?
Yeah.
Okay.
So it's not as efficient as using it manually, but it's a good alternative. If you can't, at least start with that. Then do cleaning, scaling every 6 months. That is twice in 1 year. Visit dentist if there is any decay. The best prevention that you can do is fill it up at that particular moment, because you don't want it to keep going deeper and deeper. It's not like skin. If you have a cut on the skin, your skin heals on its own. Your tooth does not. Once a cavity sets in, it will just keep on getting worse. So catch it at the earliest stage that is there. Take care of your, you can use mouth rinses and all as well. And yeah, that's about it. Just visit your dentist every 6 months.
Just one question on the teeth cleaning on a 6 months periodic teeth cleaning. But I don't know, again, it's a myth. We've heard that a lot of cleaning will,
cause gaps.
Gaps, and your enamel will also be removed from the teeth. Is there something?
No. So yeah, that myth is there. I will tell you why. Because what happens is that sometimes patients come after many years to us. As that time a lot of deposits have found on the teeth. They think it is tooth. It is not tooth. It are the deposits around the tooth. So when we do the cleaning and we actually show them the tooth, now there are gaps that are there, which are there from before, but they were hidden because of the deposits. Now that we have removed the deposits, it shows. So it is already existent. And if you leave it thinking that there will be gaps, what will happen? These deposits, they'll really like to eat your gums. So they will keep increasing in number, and the gaps will keep forming. So that is the reason people think that it causes spaces. It really does the opposite. It prevents the gums from forming those spaces between the teeth. The other thing you said.
Sorry, I'll just interrupt because we have a caller. Hello.
Hello.
Hi. Good evening. Sorry, good afternoon.
Good afternoon. Can I talk to Dr. Radhika?
Yeah, sure.
Yeah, hi. Good afternoon.
Hi.
May I know who's this?
Jyoti.
Jyoti.
Hi, Jyoti.
Hi. I wanted to ask, like, suppose in middle of the night, if the pain starts. So, because there is no doctor, I cannot go, and if the appointment is taking time, so which are the medicine I can use to, subside the pain?
So it's definitely coming from the tooth. You can make it out.
Yeah, because the pain is in the tooth. Because if hot water or anything, hot or cold, so it pains.
Is there a cavity?
Yeah.
Okay.
So, which medicine, the appointment I go to doctor, which are the medicine I can use at home, like Panadol or anything, it is okay?
Yes, temporarily till you're taking the medication, the pain will not be there. What you can do is you can take ibuprofen, or you can take paracetamol if you are allergic to any of the other medications. Then you can use Panadol, or you can take ibuprofen. Panadol, usually don't take more than 4 tablets in 1 day. Stay ahead of pain. Take it every 6 hourly, even if you don't have pain, because it will come back. Because the kind of thing you are telling me, it looks like something called pulpitis, which is a root canal pain basically. So night pain on hot and cold, very characteristic of a tooth with a cavity, very characteristic of a tooth needing a root canal treatment. But we cannot be sure until we take an X-ray, No, so prophylactically you can take these medications until you have your doctor's appointment. The minute your problem is treated, like if it is a root canal, the minute you do an emergency treatment for your root canal, that pain will go away. So your best painkiller would be the treatment itself. But till you make it to the doctor's appointment, you can take
Because
ibuprofen, Volt
because of
fast,
the pain
anything.
with the ear and head, no, it goes like really you cannot bear the pain.
And it happens in the middle of the night. So before sleeping, make sure you take it because you don't want to wake up at night with pain.
Okay.
Okay.
Okay. Thank you, doctor.
All right, thank you,
Thank you.
Jyoti. Yes, doctor, we were talking about. Sorry?
Scaling, removing teeth, tooth structure.
Yeah.
No, it does not happen. What we use is stainless steel instruments to remove it. Your tooth is made up of enamel. It's the hardest structure on this planet Earth.
Okay.
Now you cannot expect to remove tooth with stainless steel because tooth is harder than stainless steel. Okay, so no, that is a myth.
That is just a
yeah.
myth.
Some people think that because they do develop a bit of sensitivity after they do the cleaning, so they think that the tooth is chipped. But you know, the tooth had deposits all around it, so it was shielded. Now we have removed those deposits. Suddenly the tooth is coming in contact with cold and hot. So that sensitivity is there and it will go away.
Go away. And this gap, will that come together or it will just
once the gum and the bone is lost, it is very difficult to regenerate it. We have procedures. Yes, we have procedures where we can expect some amount of improvement.
Okay.
If not that, we can definitely look into other ways of closing the gap.
Closing the gaps.
Yeah, but it is possible. Cosmetically, it is possible. But we have to treat the cause so that it doesn't increase.
Correct.
Yeah,
I think we are almost towards the end of the show, but before winding it up, I have just one more question.
Yeah.
Like when kids or even adults, when they fall and knock off a tooth or something, what can be done in that case?
Like the tooth completely falls off?
Completely falls off, yes.
Okay. Firstly, I think when the tooth falls off, there will be a lot of panic.
Correct.
First thing that you need to do is find that tooth.
Okay.
Okay, wherever it is, just find that tooth. And
it will be a broken piece.
If it is a broken piece, then you have to take that piece and you have to go to the dentist's office, and the dentist may fix it or may build it up with using a filling material. But if the entire tooth that is a crown along with the root is out, you need to find that tooth, and you have to imagine that your time is running. Time is the essence. So you pick that tooth up with the crown, find that tooth, pick that tooth up very carefully, holding the crown. The crown is a portion of the tooth that you see from outside, right? Hold it from that. Don't hold the root part of it. Don't touch it and make it dirty. Now, if there is any dirt, you can use water. Don't scrub it. Just under running water, you can use it. But better would be to use milk. Milk, because it is readily available. You can just, take the dirt off. If not, you can use water as well. And then take that tooth and put it back. And hold it there.
Oh, really?
Yes.
Okay.
Yes. If you are able to pick that tooth up very carefully, just rinse it up and put it back within 20 minutes time frame. It is as good as it never came out. But the moment, if you take that tooth, put it in a Ziploc bag or put it in a container and then go to a dentist, after 1 or 2 hours, the tooth is gone.
Okay.
So take the tooth.
That's a very, very
replace
important tip. I think I don't think many of us know about it.
Yes, but this is only for adult teeth, means permanent teeth. Don't do that for milk teeth. It's okay if the milk teeth falls off.
It's okay.
It's okay, but for the adult teeth, permanent teeth, that have to be placed as soon as possible, and you have to go to the dentist immediately after that, because there are certain procedures that we also need to do depending on the case.
So that it remains there for
so
the rest of your life, or at least for some time.
Yeah, we have to splint it to adjacent teeth or do a root canal if needed.
Okay. All right. Yeah. So thank you so much, Dr. Radhika.
Thank you,
It's been a
for
pleasure being here and answering all our questions and queries. I think there were a lot of callers also today, and I hope
I'm quite glad.
I hope the conversation we had, the question and answer session, it helped a lot of people, because
I hope so too.
As a layman, even I had a lot of new things that I learned from our conversation today. I never knew that if a tooth falls down, we can just keep it and it's as good as this. That's the news. So thank you so much. That was Dr. Radhika from Sharjah NMC Al Shaba. So if any one of you would like to take her service, can visit her at Al Shaba NMC.
Yes,
and what are the timings that you're available over there?
So my timings range from morning 9 o'clock till evening 9 o'clock. I have you can take appointment basically during any time of the day.
Okay, all right.
Just give us a call and they'll help you out with the schedule.
All right. So it was a pleasure again. Thank you so much, Dr. Radhika.
Thank you so much for having me here.
So we'll meet next week with another doctor and another specialist and with another topic. Till then, you guys take care. Stay safe. Bye-bye.
Doctors In, presented by NMC Medical Center.